Good evening and good morning to everyone who's joining us. I really appreciate the team from Blackthorn from reaching out and including AWS in this conversation. So like you just heard, my name is Brian Loyal, and I am a specialist solutions architect at Amazon Web Services, AWS, focused specifically on the area of AI and ML for healthcare and life science. AWS is, of course, the cloud division of Amazon. And so what that means is that in addition to buying your favorite book or your, a set of clothing, we focus on providing a variety of high-performance, computational, and domain-specific services for a variety of customers. That customer piece is really important. When I would give conversations with teams about kind of the value we provide, that idea of focusing on our customers, understanding what they need and how we can serve them is really a shared tenet across our entire company. And this is, I think, a really great quote. This is from Andy Jassy, who's our current CEO, where he acknowledges that we have a variety of different stakeholders in our business, whether you are a consumer trying to buy something on Amazon.com, or an advertiser, or an enterprise, or a government. In all cases, we're focused on our customers and what they need. And so obviously when it comes to healthcare and life science, the customer at the end of the day is the patient. That's what we're all here for, because we're passionate about improving healthcare and patient outcomes. But there's a lot of other customers as well. So we work very closely with providers, like I think a number of the folks on the call today, whether you're a hospital system or an individual physician. We work with governmental agencies, including those that are in the regulatory or payer space. We work with pharmaceutical companies. We work with life science research organizations. And all of these have individual unique needs that we try to bring our advanced technology to bear on to help, at the end of the day, patients and patient outcomes. This is why thousands of healthcare and life science and genomics companies work with AWS for a variety of things, everything including like driving down the cost of care while improving quality, improving research and collaboration, especially in the early phase R&D type space, all the way down to, like AJ mentioned, this idea of personalized medicine, or how do you provide an engaged experience for patients and customers. One thing that we hear, though, from a lot of our customers is that even though a lot of people have acknowledged that technology is important and there's been really great advances, like we just heard, finding the right solution can be a challenge, simply because a lot of organizations that are focused, laser focused on healthcare and patient outcomes, they lack that sort of internal resourcing to assess, build, deploy their own solutions. And especially when it comes to AI/ML, and especially when it comes to regulated industries like healthcare and life science, additional requirements across the globe make this even harder. So that even though you want to get to that phase of digital transformation, oftentimes you don't have the resources or history to get there. And so that's what we bring to bear. AWS, in addition to managing the cloud systems for a variety of consumer-facing organizations, we have a large and growing organization that is focused on healthcare. We've been working in this space for more than 8 years. On average, our team has more than 18 years of experience. I have 16 years working in life sciences, and we have over 1 million active customers. And so when we talk to our customers and we say, like, hey, what do we bring to the table? This level of experience, this history working with healthcare data, working with the idea of operational efficiency in clinical settings is what we can provide our customers, both big and small. Last year, we tried to kind of reorganize the conversation in this area with an initiative that we called Aidables for Health. This idea that it's not just providing a single tool or maybe one sort of conversation when it comes to healthcare, but it's a variety of portfolios of conversations, partnerships, and services that we really need to provide. And so when we talked about Aidables for Health, it is a alignment of solutions in the healthcare, biopharma, and genomics area, including work with such industry leaders like Cerner or Deloitte or DNA Nexus, all providing both customizable and purpose-built solutions, and then access to the success of our partner network. So both solution providers, so organizations that like selling software as a service through our service catalog, but then also partners that are willing to work with our customers to build custom solutions. So if you're looking for a tool that can help optimize patient outcomes or manage billing or paying, we're able to connect you with technical teams that can do that. So whether you live on the spectrum of being a builder, maybe you have a large and diverse in-house data science or software engineering team, and you want to really get your hands on the technology and build. Or if you're looking to really buy a pre-made solution, we have options along this entire spectrum, and many customers who have told us that they like having this sort of flexibility in their solutions. Let me give a couple examples really quickly of the types of services that I'm talking about. So if you are working in the space of AI and ML for healthcare, there are a couple common needs that we hear. So one is really just accumulating data, and especially when it comes to patient-centered situations, you're talking about how do we process physician notes or medical records. So we have a pair of services that we provide to our customers. These are both part of our AI services stack. Amazon Transcribe, which is a speech-to-text service, and Amazon Textract, which is a way of extracting handwritten information, data tables from scanned documents. In both of these cases, we have seen customers very easily and at scale extract this sort of raw information into a much more easily processable form without having to roll their own transcription software, for example, or go find some expensive third-party service. We provide this in a managed fashion so that developers can integrate it, and in some cases even provide a UI for customers to integrate with. Once you have this sort of data, we provide a service called Amazon Comprehend Medical. This is a managed natural language processing service that allows you to scan text and provide meaning. So in this case specifically, it will map terms, prescription names, dosage amounts, conditions to ICD-10 and ARCS-norm parameters. So you can tag information very easily to make it possible to search in this data and perform things like advanced AI or even just visualization of the images. And finally, we have data storage solutions like Fireworks or Amazon HealthLake. These are services which are tiered specifically at patient health information. They are FHIR compliant at petabyte scale. So whether you are a large multi-state or multi-nation healthcare organization, or a very small startup just getting started with a particular type of application, these services can scale to meet your needs. So for the rest of this talk, I'm going to talk about some very specific case studies. I've kind of gone through kind of what our mission is when we talk about AWS for Health, an example of the sort of services that we provide, especially in the AI ML space. But I want to really get into some very specific case studies about how our customers have used these tools to provide value. And both because of the topic of today's conversation, which is AI, and my own background, I'm going to focus on analytics and AI ML. So how do we use some of this advanced machine learning technology to really derive insights and make better decisions about healthcare? So 4 specific use cases I'll cover. One is around quality measures and reporting. So how do we identify that our practices are providing value and report those to the right organizations? Operational optimization. So how do we do our work more efficiently and more effectively? Health and disease prediction, which is really looking at historical information to make a prediction about an individual or a group of individuals. And then population health, especially important when it comes to settings like now when we're dealing with a global pandemic. What can we learn about looking at large populations of individuals and then deriving insights from those? So first off, let's talk about quality. So the idea here with quality reporting is that we need to have systems that allow healthcare providers to publicly report process and outcome metrics to determine quality of care. And whether this is to, for example, prevent hospital readmissions or hospital-acquired conditions, you can't make changes unless you have intelligence, right? And reporting that intelligence and collecting it in the right way is a key part of really any sort of process improvement or enablement work. Our example here is from the Maryland Department of Human Services. They came to us saying that, hey, we needed to have a new system for doing this sort of reporting. And so they worked with AWS services plus partners like Slalom and ZS to build a system they called the Total Human Services Integrated Network, or MD-Think. And this is a way to deliver integrated health and human services to really the state's most vulnerable residents, a lot of the people that they work with day in and day out. This was the first in the nation system like this. It was completely cloud-based. And it provides agencies with that holistic view of data across multiple agencies that they can then use to improve their programs. So again, the idea here is using cloud services that are accessible to technical teams within this organization to collect this information and present it in a very unified way. And this is something a really great place to start, I think, for any sort of provider or organization if you're looking for projects to get going. Next up, I want to talk about optimization. I think that especially in this area of increasing healthcare costs and that need to improve our efficiency, everyone is looking for ways to improve our operations, and especially if you can maintain or increase the quality of patient care at the same time. So here, the example is an organization called Cambia Health Solutions, and they have built an integrated human-centric healthcare solution on AWS using a lot of the AI and ML tools that I mentioned a little bit earlier. So here the challenge again was creating a holistic evaluation of patient health risks. You have a lot of information out there around medications, conditions, predictions. How can we bring that together and really better understand the best way to treat the patient? In this case, they're using AWS services like Comprehend Medical and SageMaker to shift a lot of their data science resources away from this more generic data processing, data munging, quote unquote, tasks to really building the solutions that directly impact the business. So by leveraging managed AI services like Comprehend and SageMaker, some of their most technical team members can really start focusing on high value, really focus on solving the problems that make the most sense for the organization. In this case, it's consolidating information to drive down waste. A third example I want to show is from the Children's Hospital of Orange County, so CHOC. This is one of the nation's leading children's hospital in the U.S. And in this case, they were looking for some tools that can proactively address patient health. So, for example, how can you analyze your data pipelines across these different systems and generate risk predictions that can maybe predict hospital readmission or other sorts of conditions that you could address or prevent with just a simple change in process. So in this case, CHOC worked with one of our partners, Cerner, to develop what they call the Health Data Lab. And this is a cloud-based machine learning solution built on AWS that helps CHOC identify patients with high readmission risk and give families the support they need before a child is discharged. It's a lot cheaper and easier to provide that care in a proactive way than it is to treat that patient a week down the road when they return to an emergency room, probably in a worse condition. Another great example in the same sort of bucket, it's not in this slide, but fairly recently, UCSD, so the University of California at San Diego, they created a model for detecting pneumonia during the COVID-19 pandemic. And interestingly enough, they were able to get this operational in just 10 days, very, very rapidly. It processes images in a secure HIPAA-compliant cloud environment and then uses AI to predict the likelihood of disease. So again, developing really innovative, impactful solutions fairly rapidly using pre-built managed solutions that make it easier to get up and running and started. The last example I want to share today is from Rush University Medical Center, and this is around population health, which again is a really important way to make sure that we're treating not just individuals, but also groups of individuals that maybe share some characteristics. So the idea here is how do you develop systems that help you do things like cohort development, risk stratification, care management at scale, so across entire large populations of individuals. So with the case of Rush, the Chicago Department of Health needed a way to bring together a bunch of different data, all regarding COVID-19 across the various cities' hospital, really to understand what COVID care was looking like on a real-time basis, and also hospital capacity, where they were overburdening their staff and resources. So Rush University Medical Center created a data analytics hub, pulling data from 17 different hospitals using AWS, and they stored this in FHIR format that allowed them to create a dashboard of key population health metrics. So using cloud services to, again, aggregate this data into a very accessible place and provide really important insights about where should administrators direct their attention and their resources to make sure that we're improving both the opportunity to great care, but also improving equity for individuals that we serve. So a lot of really good examples in addition to these that I can share about the way that we have worked with our customers and with our partners to deliver higher standards of care. There's a lot of ways to engage. If any of this resonates with you, we have individuals like me who are responsible for talking to customers and helping them navigate all the different steps involved in leveraging advanced services. We have teams like our ML Solutions Lab or our professional services team that really work deep dive in a hands-on fashion with customers to help them understand, like, what are some good opportunities? Where have we seen patterns like this emerge in the past? And like I said, we have a really great group of partners. These are the individuals like Cerner, like Deloitte, who are experts in using cloud services, but also have a domain expertise to really help solve problems in the right way. So where I think I'll maybe close today is just this reminder that when it comes to developing AI solutions, and especially doing it at scale in regulated environments, you don't have to do this alone. And whether you want to build custom solutions using managed services that help you get up and running faster, or you want to take a very much a buy or acquisition approach. I want to buy off-the-shelf solutions that help me solve common problems. Cloud providers like AWS and our partner network provide a lot of different ways to get to those goals. So with that, I think I will probably take a pause and open it up for any Q&A.